Well, that's a big question, right? And I think that the real key is, I think that leaders today need to develop a real strong core competency in these chaotic components. So how much do we really know about the beyond the patient experience design? Because we really have to look at patients as consumers, and we need to build competencies around consumer experience design. Does that live currently within your organization? If not, how do we fill this critical gap emergently? I think when it comes to human experience design, do we really have an optimized strategy in HR and workforce development and across the organization to really make certain that we are building a brand around our mission, where we're building personal growth strategies for our employees, and that we are serving our patients through this new concept of HX design and through happiness as a strategy? In fact, that's a new term, happiness as a strategy. It's powerful, it works. I know it sounds a little bit squishy, but the truth of the matter is the best organizations in healthcare will make happiness and consumer happiness a core competency as leaders. All leaders will get training. All leaders will really sharpen their skills. They'll have executive committee teams around these topics to make sure that they're constantly improving skills and making sure that they're on track with really developing the right stuff. I think the other takeaway is that, we are in a time of rapid technological advancement. Yet when I interview many CEOs, I'm surprised to find out how unaware they are of the impact of emerging technologies. What does metaverse mean to healthcare? Maybe more than you think. What is the impact of anticipatory healthcare? What will happen in terms of this new movement towards anticipation and prevention over gratuitous intervention? In other words, what are the trends in technology connection architecture that we need to know as leaders, and how do we get those insights on a regular basis by developing a core future casting team? And I recommend that leaders develop those teams because they are not a waste of time. I'm not a big team person because I don't like taking important people away from their work. But I believe that having future casting teams where you bring in people that have orthogonal thinking, in other words, they don't see the world in the same way you see it. Bring in external technologists, bring in AI experts, bring in these technological experts to really make sure that you understand these principles so that you can apply them in a really practical way. Another thing I strongly recommend to leaders of health systems and hospitals is that you absolutely make sure and support your chief information officer by giving them the budgets and the resources they need. Some people are now suggesting that hospitals and clinics are technology organizations that happen to deliver efficacious care. That may be true. In other words, our core competency as hospitals and clinics, or anybody in healthcare, is that of the technology substrate. Lastly, everybody is going to get displaced in healthcare by a new model that is a new economic model, a new clinical model, or a new value model. Everybody is going to get disrupted. The good news is that we can be a participant of these disruptions. We don't need to be displaced. We can leverage new economic models, new value models, new approaches in clinical delivery in a way that makes us contemporaneous and relevant. So if we know what those are, if we know what the quiver looks like, the toolbox, then I believe that we can build out some solutions as good as anybody else. So there you go. I think that when we really think about the future of healthcare, it's really exciting. I think most of the leaders that are watching this program will agree that we have never had a better time to be able to leverage great technologies and new solutions that will really positively impact patients and our stakeholders. I believe it's a beautiful time for us to rise to the occasion of chaotic innovation and really make a difference in the way in which we deliver care.